When the going gets tough, people in Italy's so-called red zones keep calm and carry on. With face masks, of course. The tasks of daily life, like making pizza at home with the children, take on renewed meaning. We're rediscovering things that in the daily grind went on the back burner, Maria Cristina Baggi tells me via the internet. Her 9-year-old daughter, Cecilia, continues her classes online. We're living in serenity in our family, Maria Cristina says. We're enjoying our children, who we almost never saw because of work. It's not easy, however, when one's life is turned upside down by an invisible threat.
Buongiorno, anche se non è tanto un buongiorno.
Good day, even if it's not a good day, says Monica Moretti, who's been posting her drives around the largely deserted streets of her town of Casal Pusterlengo.
Questa è la situazione.
The supermarket is running low on cheese. Prosciutto supplies appear to be okay. The start of the coronavirus crisis was unnerving, she recalls.
All'inizio sembrava di essere in un film catastrofico.
At the beginning, it was like being in a disaster movie of germ warfare in which people are dying, she tells me. After more than a week, however, she and her daughter have settled down to a routine.
È piacevole passeggiare.
When the weather is nice, she says, we go out to walk for a few hours, but mostly we cook and eat. It's odd. We continue to eat because when you have nothing to do, it's probably a mechanism that clicks in your head telling you you're in trouble and need to eat. Such stoicism aside, Italy is in trouble. At a press conference in Milan, it was hard for the assembled officials and medical experts to downplay the gravity of the situation. They announced the red zones will stay on lockdown for at least another week. Dr. Massimo Galli is head of the unit for infectious diseases in the Milan hospital where many coronavirus patients are being treated.
I am afraid that we will to expect other cases in the next,
many cases.
probably many other cases in the next weeks.
This outbreak isn't a movie, but it's starting to look like a disaster. Ben Wiedemann, CNN, Milan.
We are working on cures and we're getting some very good results. As you know, they're working as rapidly as they can on a vaccine for the future.
But what does rapidly mean here?
If this were 10, 20 years ago, maybe even 5 years ago, we'd be looking at a time frame of years before we were actually seriously considering having a vaccine available.
Peter Hotez has dedicated his life to developing vaccines, including one that targets coronaviruses.
Now we're compressing that timeline to months.
And around the world, there's now a race to develop a working vaccine to fight what's on the verge of becoming a global pandemic.
Although this is the fastest we have ever gone from a sequence of a virus to a trial, it still will not be any applicable to the epidemic unless we really wait about a year to a year and a half.
You see, even if a vaccine looks promising in the lab, all that matters is how well it works in the general population. And it takes multiple steps to prove that. First, that it is safe, and then that it is effective, and ultimately, how it compares to other treatments.
Clinical testing is going to take a lot of time. We have to do extensive testing, both for safety as well as efficacy, to show that the vaccine is preventing the infection.
And there's an added challenge: attracting pharmaceutical companies to actually manufacture it.
It turns out that many pandemic threats are not big money makers for the large pharmaceutical companies.
But it is much more than a matter of turning a profit.
This vaccine is not only going to be needed to help public health, but it's going to be used to stabilize the economy. It's going to be used to stabilize global security.
President Trump's top health officials warning Americans that the coronavirus spreading is, quote, inevitable. And for the first time since the virus broke out, there are now more cases, new cases, outside of China than inside, according to the World Health Organization. Joining me now to discuss, Dr. Erica Shenoy. She's the Associate Chief of the Infection Control Unit at Massachusetts General Hospital in Boston. Dr. Shenoy, thanks for joining us. There are only 12 labs in the U.S. that can test for coronavirus at this time. How significant a problem is that?
Well, so I think it is limiting in terms of our ability to test patients who might have coronavirus. However, I know that there's a plan in place to make that test more widely available. So as has happened in the past with the other coronavirus, most recently MERS in 2012, eventually states' labs were up and running, and then there eventually became commercial tests available.
So the FDA warned that some medical products such as face masks or gowns could be at risk for shortages. Does wearing a face mask prevent coronavirus from spreading? Should people start stockpiling them now?
No, and maybe I'll explain this because this is one of the most common questions I get from colleagues and from family members alike. So why do we put surgical masks on patients? So if you have a cough or you're sneezing, like you might have the flu, every time you cough and sneeze, droplets of that contain that virus particles are coming out of your mouth. And so when we put a surgical mask on a patient, we're containing that from spreading. If you're healthy and walking about, there's really no need to be wearing the mask. And I do worry, number one, it's a false sense of security. Number two, it eventually will impact the supply, and we're already feeling the impact of the supply at the hospital and in healthcare settings where we need those masks both to mask patients who are ill and also to protect healthcare workers.